There are many types of therapy in the psychology realm. Some are more than suitable when dealing with addiction and recovery. Many licensed therapists and caring psychologists use more than one of these models at the same time for an overall personalized treatment therapy system, depending on the patient and his or her unique situation. What are the types of therapy one can explore in drug and alcohol addiction recovery centers? Stay tuned. Cognitive behavioral therapy. Cognitive behavioral therapy, CBT, is a type of therapy that holds the model that thoughts, feelings, and behaviors are all connected. It was first used to treat depression patients, but was found effective in helping patients overcome anxiety, PTSD, traumatic memories, addiction, and psychotic disorders. CBT is helpful for anyone recovering from addiction because it builds your personal awareness of your own thoughts, actions, and often ignored emotions, helping you reflect on the consequences of each. Contingency management, also called motivational incentives, it's been noted most effective with defiant disorders, addiction recovery, and impulsivity. The idea is based on operant conditioning wherein helpful and desired behaviors are rewarded and harmful or undesired actions are punished. Those in recovery will find it helpful because many times addiction is influenced by social, learned, and biological factors. Therefore, with operant conditioning, the patient is able to relearn beliefs about which actions are desirable to him and why. Mindfulness-based therapy. Mindfulness cognitive therapy, MBCT, works as a method of relapse prevention in that they can align with new beliefs, thought patterns, and meditative exercises. In doing so, this can prevent a pattern of downward spiraling that leads to relapse or major depressive episodes. Through breathing, self-awareness, meditation, and increased mindfulness, patients step away from attachment to negative feelings and take some space before reacting abruptly to triggering emotions and situations. The practice also helps recovering addicts in finding practical tools they can use at any time and place to prevent difficult temptations of relapse. EMDR. EMDR, eye movement desensitization and reprocessing therapy, was popularized for those suffering from depression, anxiety, and PTSD, and uses an 8-step formulaic approach. Therapists utilize specific eye movements for the patient in order for them to reprocess past traumatic experiences that may have been shut off or blocked out of full processing. Motivational interviewing. In motivational interviewing, the therapist encourages the patient to reach empowering decision-making skills in order to live life in a more motivated way. Those in recovery from addiction benefit greatly from goal setting and continual motivation. It opens up the change for any patient to reflect on where they've been, what they want to do to change their circumstance, and take the realistic steps in order to reach a new lifestyle. REBT. REBT, Rational Emotive Behavior Therapy, takes into account two main things: thought, which is how a person uniquely perceives something, and emotion, which is the feeling a person has about the situation. A person holds positive and negative beliefs, which can be learned or influenced throughout life. Beliefs can also be changed for the better. The goal is to work through reaching better beliefs about the self, others, and expectations about life. Matrix model. Matrix model is combined with an IOP, intensive outpatient program, uses a mix of effective practices, and usually lasts around 16 weeks. Individual therapy sessions, as well as group and family sessions, are held in this matrix model. Other addiction recovery-based programs are implied, such as 12-step programs, support groups, relapse prevention classes, recovery skills workshops, family education, and community support. The goal is to offer as much support as possible while the patient works through his or her thoughts, beliefs, and behaviors that came with addiction. Multidimensional family therapy. Instead of treating only the addicted persons in the family, therapists using the multidimensional family therapy work with all members of the immediate circle of loved ones to address the issues that came before, during, and after a harmful addiction. Usually involving private sessions with each family member, it gives all people in close relationship with the addict to find the support and understanding they need in a sensitive time, while still providing love and support while the addict goes through their recovery journey. As you can see, there are many options one has when choosing therapy for their recovery. Do you need help deciding which is best for you or a loved one? We at Opus Health can help. Reach out through our site or give us a call at 949-625-4019. We're here to help begin the journey into long-term sobriety.